Hey y'all, welcome to our YouTube channel.
Hey,
My name is Ansley and I'm an oncology nurse.
and my name is Luke, and I am a junior nursing student in the BSN program.
And we are brother and sister. And today we're going to talk about how I passed NCLEX in 60 questions and it only took me 30 minutes.
Okay, so tip number one.
Tip number one.
Or the way that she passed it, number one, whatever.
Yeah, the way that I passed it, number one, is whenever I was in nursing school, I studied to learn the material, not just to brain dump and pass the test.
So important. You need to study for your test and study to pass the test, but don't study just to pass the test.
Yes.
You need to carry the information through every test.
Right, because like in pre-nursing, you could do that. You could study for the test, blah, 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 dump it out on the test, and then like forget it. Or like all through growing up school, you could just do that for the test. Well, for nursing school, you're in nursing school to study to learn about how to treat actual live people.
Yeah, you're going to use that knowledge in your career, so you have to remember all of it.
Yes. Well, there's some things you can forget,
Yeah.
but you know,
once you
more
specialize
or less,
in your area. Yeah.
So anyways, that is what I did. Whenever I was studying, I always thought, okay, this is going to make me be a good nurse, not this is going to make me pass the test. Because passing the test is not just my goal. My goal is to be a nurse. And so sometimes that would also help me if I didn't get a grade that I wanted. And then I was like, okay, I know 80% of this material. So that means I know a good amount of this material. I can probably be a pretty good nurse, but there's just some things I have to concentrate on.
Right.
So it's really important to study during nursing school, even if you're really good at absorbing material and just like vomiting back out on the test, you need to be able to study it because you need to know the ins and outs of it because you're going to deal with it in people later.
And how to apply it to that clinical setting.
And the application is key also because on NCLEX, you're applying the material that you've learned.
Right. Okay. Tip number two.
Tip number two. Practice questions.
So many.
Practice questions, super important. Because the NCLEX is not necessarily, you don't really need to be like content heavy to know the NCLEX questions and how to answer them. You need to know how NCLEX asks questions and how they answer them. So how you do that is you just literally have to practice questions. Even if you don't know the material that the questions are questioning over, practicing answering those is what's going to help you pass NCLEX. Because a lot of the times on the NCLEX, there's going to be questions that you don't know, or there's going to be aspects of the question that you don't know that disease, or you don't know that medication. And so you need to have strategies that you use when you're practicing that you can apply to NCLEX.
So what are some of those strategies that you can use, just really quickly?
So some of those strategies are, one, airway, breathing, circulation, the ABCs. So this is a priority setting framework. If you're given a question that has to do with an airway, breathing, circulation, the one you need to look at first is airway. Is there a question that has to do with fixing an airway? That's probably the answer. Fix the airway. Or fix the breathing, or fix the circulation.
Right, because if you don't have good airway, then it's not really going to matter if the blood is circulating because there's going to be no oxygen getting to the tissues.
What's going to kill you first?
Yeah.
That's what you got to look at.
Okay,
what's going to kill
the
the patient first? The next one is going to be Maslow's hierarchy of needs. We need to know that because a lot of the questions have to do with Maslow's. And so if you can think, okay, what's the most important at the bottom of this hierarchy and what's at the top of this hierarchy, then apply that to the question, and then you can answer the question that way.
Yes, that one has helped me already just in my first semester on so many questions. Okay, one more.
Next strategy is whatever is the safest option. You need to do that. Look at the question, look at the answers, what's going to keep the patient the safest, and then that is going to be the answer because NCLEX is all about safety. So whatever is going to be safest, pick the answer. Safety, answer.
And we'll do a video later on more test taking strategies because there's so many and they're also important and we can go further in depth on those.
And it would take so long.
Yeah. Okay, tip number 3 for how she passed NCLEX in 60 questions, 30 minutes.
So, we did, in my school we used ATI. This is one of the books that we use for like review. This one's the pharmacology one. But it has a bunch of practice questions at the end of each section, and it hits like all the highlights of everything you need. So anyways, because we used ATI, we had a 3-day review at the end of my senior semester. That was an NCLEX intensive. So we did
very intense.
Very intense. So we did 8 hours for 3 days straight, and because it was Corona, we had to do it on Zoom, and that was very interesting. But anyways, it was so helpful because we hit all of the NCLEX areas, and then all of the highlighted disease processes, problems, all that, and we did all these practice questions, and I was able to really pinpoint what my weaknesses were, and my weaknesses were peds and OB, basically, were my weaknesses.
So find out where you're weak, practice on those.
Yeah.
Maybe go a little bit easy on the areas where you're really confident.
Yeah, don't study the ones you're confident on.
Yeah.
Just don't. You don't even have time. You just do practice questions over the ones you are confident on. Don't even look at them.
All right. Tip number 4?
Tip number 4 is look at those weaknesses. So you're gonna have to look at the weaknesses that you have, and then you do need to do a little review. So one of the things I used for my review is the YouTube videos from Level Up RN.
Ooh,
A shout out to her. She does like 5-minute videos on like 2 disease processes, and she hits the main highlights, and it really pulls those from your memory from what you studied when you were in nursing school.
Because you already studied it.
Yeah, and then you're able to remember those highlights, because really you just need to know the highlights of things, and it's going to jog your memory of all those. So I would watch her videos on the peds and OB, all those little illnesses, and then I would go do some practice questions on those to really cement those into my memory.
Yes.
So that's really important, to look at your weaknesses and then just do quick reviews. Don't go back and read your textbooks.
No.
Find quick reviews like from Level Up RN or Sarah RN or
Be
any
efficient.
of those. Yes, because you're going to overwhelm yourself.
And wear yourself out and burn out on studying.
Mm-hmm.
Okay, tip number 5, last one.
Test
day
5.
Strategies.
Test day strategies. So be as normal as possible. So I like to take my tests in the morning and be done with them. I'm a morning person, so I set my test for 8 a.m., which was the earliest slot I could get. And then I woke up like at 6 a.m. and I ate breakfast and drank my coffee, and I just tried to be normal and just say, okay, Ansley, you're going to take a normal test, and you're going to pass it, and you're going to do good. So you have to have positive self-talk too, because if you're getting inside of your head while you're trying to take a test, any test, you're going to mess up because you're just like already, I'm going to fail.
Yeah.
You have to think you're going to pass.
Once you've already done the studying, you've already done all the prep that you can, you just have to be so confident going into the test, even if you're actually not, and even if you aren't super confident in what you studied or anything, you have to go in thinking, I've got this, I'm going to pass, I'm going to get 100%, and go in with that confidence. It will help you so much.
So, because literally you just studied for 4 years to take this test.
Right.
And then you did your extra studying on top of it. So you're prepared, you know the material, just go in and take the test as normal as possible. So it is kind of sketch whenever you go in because you have to do a palm vein scan, so you feel like you're in the FBI, and then they take your mug shot, so you're like a criminal. Just kidding, but they
And hers was hilarious because she did look like
funny.
a criminal.
Wait, I had to show it.
Okay.
I actually had to show it. That's right. Wait. Ahaha!
Here it is. Let me focus it.
See?
That's the face you're going to be making when you go to take the NCLEX.
That was before.
Okay.
So that was before the test, and I was so scared. I was shaking so bad. Anyway, so they do all that. You go into a test room, and for us, there was like 10 people in there because of COVID, so social distancing or whatever. And then it's this big computer, and I did not want to look. I didn't look at the timer because, or at the questions, because that would kind of stress me out.
Yeah.
And it's just up in a corner, so I just looked straight at the computer. And so basically, I used one big strategy is pick and stick. I picked an answer and I stuck with the answer. I didn't change it.
And then just move on.
Just move on. Don't think about that question anymore. Once you go to the next question, don't think about it.
Forget about it. Put that out of your mind. Don't worry. Did I put this right?
Yeah. Just don't even think about it.
Yeah.
Next thing, read the question, and then don't look at the answers and think of the answer. Because if you can think of the answer and then you look and there's the answer, perfect. Don't have to think anymore, just click it and go. So I tried not to look at it at how many questions I was at, and then when I finally did, I was at 54 questions. And with the COVID time, you could pass a minimum of 60 questions. So I was like freaking out, and I was like, oh my goodness. Well, then I was like, I'm not going to look anymore. And then I would click. Well, it was 58 questions. I looked again. So I was just like, okay, don't think about it, Ansley. If you go past 60, 100% fine. Like, if you're going past 60 questions or 75, whatever the minimum is, do not mind it. You can pass in any amount of questions. Like
all the way up to the maximum.
Yeah, you can pass. Even if you take the maximum questions.
Right.
So do not worry. Just only think about the questions that you're on, pick and stick, and just answer them, move on. So anyways, hit 60 questions, the screen turned blue, and then it popped up a post survey about how your experience was. And I'm like freaking out. Post survey is like 18 questions. I'm like, click. And then I got up, and then they palm vein scanned me again so I could leave. And I got my stuff out of a locked locker, and then I ran out, and it had only been 30 minutes. And I was the first one to leave. And then me and my mom sat in the car, and nobody else was coming. For like 15 minutes, we sat on the stadium one. And I was like, either like I totally bombed it, but I didn't think I bombed it because I had like so many higher level questions. So I was like, I just passed NCLEX in 30 minutes? Like, whoa. So I was a little bit.
Yeah. And then she did the Pearson VUE test.
So my dean made me do the Pearson VUE test. She didn't make me, but she kept texting me. And so I was like, fine, I will do it. And so that evening, I did the Pearson VUE trick, and you'll have to look up another video about how I do it because I can't remember all the way, but I did it and got the good pop-up.
Which means that you passed.
That means I passed, and I'm like, okay, cool, I passed. But then, like, you're still waiting for
the like
license
official
and everything. So then that night at like 10:30 or 11, my dean texted me again, and she was like, "Your license is up on the website," and I was like, "Oh well, I passed."
Yeah.
And then,
pass again.
And then the next day, 2 days later, they posted my results and sent me the results, and I was like, "So don't pay for the expedited results."
Yeah,
like,
don't worry about that.
Yeah, I didn't do that. Then that following Friday, so like 4 days later, they sent me my mugshot in the mail and said I passed. So.
Yep.
And so passing was amazing. Totally, like, huge weight off of my shoulders and my whole body. I was like, oh my goodness. So use these strategies that we talked about, and we will make a more in-depth test taking strategy video because both of us did get pretty good at taking tests.
Yeah.
I learned how to take tests while I was in nursing school, and then I just was like, wow, I can take tests now. And Luke's pretty good at taking tests too, so we can go into like the tips that we use, the strategies that we use, and then that'll be more informative about how to actually take tests and study for nursing school.
Yeah, so let us know if you have any questions in the comments below. Give this video a like and subscribe to the channel. And we'll see
pass
you in
your
the next video.
NCLEX.
Yeah, pass the NCLEX.
You can do it! Bye!
Adios.